and welcome to NHIS in a Week. We bring you highlights of activities within the authority and the scheme. Coming up, we look at the requirements health facilities must meet in order to be credentialed by the authority. We take a closer look at the regulation processes private health insurance schemes go through to be eligible for operations in the country. Now to our first story, we look at the role of the private health insurance scheme of the authority, the regulator of private health insurance schemes in Ghana under the National Health Insurance Act 2012, Act 852.
The National Health Insurance Act 852, 2012, has given the role and the mandate to the National Health Insurance Authority to regulate the activities of private health insurance schemes in Ghana. Based on that, the Private Health Insurance Directory was created to take this challenge or to take this role on behalf of NHIA. And by regulation, what we do is we register, we license, and we supervise private health insurance schemes in Ghana. So we regulate them, and by regulation, we register them, we license them, and we supervise them. And by supervision, we do what we call monitoring. We do quarterly monitoring, we do end-of-year monitoring. And this monitoring is also divided into two. We do physical monitoring, as in we go to their facilities or their offices to see what they are doing. We also do what we call offline monitoring, where they submit their reports at the end of the quarter or at the end of the year for us to review and write to them. And when we do this, that is when we see how schemes are operating, whether you are solvent, whether you are profitable or you are not profitable. These are the issues that are normally noticed when we look at their books or when we look at their reports or when we go to monitor them in their various offices.
The director of the private health insurance scheme, Mr. Hudu Issa, says the authority has put in place measures to deal with unlicensed private health insurance schemes.
The first thing we do is we write to the Registrar General's Department to conduct what we call a search, to find out those who are behind such a company. We get in touch with those who are behind the companies and we advise them to come and regularize. However, when we ask them to come and regularize and they are not coming forth, then the necessary action is taken. Normally, we refer them to the CID for investigation. When it is investigated and it is true that they are operating without licenses, then they go ahead to prosecute them.
If you are a health facility in Ghana and you want to work with the NHIS, your hospital must be credentialed by the NHIA. The directorate in charge of credentialing all health facilities under the scheme is the Quality Assurance Directorate. We spoke to the director of the Quality Assurance Directorate, Mr. Ishmael Osei, who takes us through the process.
Hello, in this week's NHIS in a Week, we take a look at the quality assurance, particularly credentialing. If you're a health facility and you want to, or you are on the scheme, or you want to be on the scheme, there are certain requirements that you have to follow to get credentialed by the authority. So this morning we are here with the Director for Quality Assurance, Mr. Osei, who will throw more light on what it takes to be credentialed under the authority. Hello, Osei.
Hello.
Thank you for joining us.
Thank you.
Briefly, we'd like to understand what credentialing is about and its importance to the authority.
Okay. Thank you for asking. Credentialing is a formal process by which healthcare providers are granted license to work with the members of the scheme through the facility. So it is not only granted to facilities who want to work with the National Health Insurance members, but also the private health insurance members. So it's granted to facilities both for private health insurance and national health insurance.
Okay, so what are some of the requirements that a health facility would have to go through, or the process?
Okay, right. A facility that is making an application will first of all have to have the requirements. One of the requirements is that they need to have a HIFRA, Health Facility Regulatory Authorities license for all facility types. In the case of pharmacy, they also have to have the Pharmacy Council license. So they have to have these licenses, either the Pharmacy Council or HIFRA certificate or HIFRA license. And then they have to make application, the SANS, they have to make application, and then they have to go through the processes, documents to attach and all that thing. Now, we used to do it on manually, but these days we do it online. So you need to go online and make the application, make the payment, the required payment. All facilities don't pay the same amount. Facility types are very different. So for instance, primary hospital will pay 1,500 Ghana cedis. A clinic will pay 1,000 cedis. They have to make the payment, and they have to attach the payment to the application online, and then that will complete. And then the next process is we vet the application, and then we go through all the process. We go to the facility when it is time. We go and assess the facility. If the facility passes, we grant them the license. Now, a new facility that is coming on board for the first time would have a license for 4 years. After 4 years, they need to apply again for renewal. But for a facility that is making a renewal application, it's for 2 years, and then after 2 years, they need to make application again. But in all cases, the application has to be done 6 months before, so that we'll be able to have enough time to go through the process.
This week on Health Tip, we highlight on monkeypox virus. We spoke to a medical practitioner who throws more light on the infectious virus.
Let me share a few thoughts on monkeypox disease. Monkeypox is a zoonotic disease caused by the monkeypox virus. Zoonotic means it spread from animals to humans. How can this happen? This can happen when humans come into contact with blood, body fluid, and lesions of infected animals like rats, squirrels, and monkeys. It can also occur when we consume poorly cooked meat and products of infected animals. But humans can also spread to human beings through droplets from coughing and sneezing, contact with blood, body fluids, and rash of infected individuals, and contact with contaminated clothing, bedding, and linens of infected individuals. How will one know the person has monkeypox virus? There are some symptoms to look out for. Fever, which simply means increase in body temperature, headaches, body aches, weakness, and swellings all over your body, especially of the lymph nodes. Usually, this will start between 5 to 21 days after you've had any contact with a person or animal suspected to have the monkeypox virus. The fever is followed 1 to 3 days afterwards by a rash. Typically, this rash covers the soles of the feet, palms of the hands, mucosal membranes, conjunctiva, cornea, as well as the genitals. How do you prevent yourself from getting the monkeypox virus? Simple. Protect yourself by avoiding contact with animals that could harbor the virus, including dead animals. Avoid eating the meat of animals that could harbor the virus, or ensure that they are thoroughly cooked. But certainly, practice good personal hygiene. Wash your hands always, especially after contact with infected animals or persons. Friends, stay well, stay healthy.
I'm a pregnant woman. How much do I have to pay to get health insurance card? Will the card cover all costs during my 9 months journey?
Madam, pregnant women do not have to pay anything to get NHIS card. It is free. Your NHIS card covers antenatal care, normal delivery, cesarean session. What you need to do is go to the nearest NHIS district office, show evidence of pregnancy, doctor's report or scan, and get registered or renewed. In an unfortunate incident where you are charged for healthcare services, please insist on a receipt. Contact the NHIA on 054 444 6447. Produce the receipt upon request, and our client and provider relations personnel will investigate the payment and get a refund for you.
next is NHIS Tidbits.
Did you know that you can renew your NHIS membership without going to the district office? You can renew your NHIS membership through your mobile phone by dialing *929#. If you have linked your NHIS card with your Ghana card, you can renew via mobile phone with your Ghana card number.
This is how we wrap up this week's edition of NHIS in a Week. For more stories, do log on to our website, www.nhis.gov.gh, or follow us on all our social media platforms. My name is Vida Educhumwa Boateng. Thanks for watching.